Hi guys, we'll be starting the quiz soon. We're waiting for everyone to join. I'll be sending the quiz link soon. Guys, the link of the quiz has been shared in the Telegram group. Since we have started late, we'll be starting the quiz at exactly 10:15, okay? Alright guys, so welcome to the JuxtaMed quiz show. Tonight we're diving into the deep, fascinating world of medical knowledge, where wit meets wisdom. For those of you joining us for the first time, this is the ultimate platform to challenge your mind, learn something new, and have a good laugh along the way. Before we dive in, let's give a quick shout out to our socials. Follow us on Instagram, Twitter, and Facebook at JuxtaMed Quiz Show for exclusive updates, behind the scene fun, and more challenging quizzes. And don't forget to tag us in your post tonight. You might just get our special mention in tomorrow's session. Okay. We'll be starting the quiz at 10:15, okay? Remember, there are a few disclaimers. We have no negative marking. So you can feel free to answer your questions. Each question gives you a good advantage, stating that you'll be able to move up to the leaderboard. Just be fast and accurate, and even in case you are not accurate, at least you will have no negative marking. All right. Okay, since there are other people also joining, we'll just wait for more 5 minutes, and then we will dive into your first question. All right, 5 minutes to go. So as for tonight, it is just me, Dr. Rupal, holding down the fort. Dr. R&D and Dr. Manoj will join us tomorrow, with even more brilliance and banter. But for tonight, let's focus on this session, which is based on your surgery topic that includes your trauma and LGID. I hope you guys know what is LGID, what does LGID comprises of. Remember, each question, the fastest finger wins with the accurate answer, right? All right, so we have some more time, giving you some more time. Four minutes to go. Guys, is one introductory slide, so you don't have to answer anything in that. That is the first slide. It is just a mention to our public page. We'll start. Shashank will start at 10:15, 1:5. Okay. Till then, you can just read up your points, remember what you have read, maybe some tables that you want to revise. Oh, no last minute revision, is it? Okay, okay. I think everyone is just buckled up and ready to go with the quiz. Guys, join us on the YouTube live as well so that you'll be able to hear what I'm saying along with the music. Three minutes to go. Till then, guys, remember we come every day, every night at 10 p.m. onwards. And ten p.m. onwards, guys. Please let me know if you can hear my voice. Last 2 minutes. Guys, you can address me. Can you hear my? Guys, is the voice audible? Please let me know in the comment section. I think yes, it is. Okay, guys, we'll be starting the quiz in 1 minute. So sit tight. So before we start, remember, we have got 10 intriguing questions lined up, each with a few seconds of timer. I will read the question, share some related insights, and as just the timer buzzes, we will reveal the answer. So ready to flex your medical muscles? All right, so let's go. This is just a slide. All right. So you can see it's by JuxtaMed quiz, right? All right. So the first question: what is LGIT primarily used for? So basically, you should know what does LGIT mean. That is lower gastrointestinal surgeries, and it's been used for treating colorectal cancers, diverticular diseases, and severe inflammatory bowel diseases. It's the go-to surgical intervention when medical management falls short. Let's see. Nice, nice. All right, guys. So good going. Let's see the leaderboard. We have Ray in the top, followed by Heyman, then Thunderbreaker, Leo, and Shamili. As you can see, guys, from the start of the question, start of this quiz, the competition is cut through. So remember, just keep your pace up, right? And be focused. Moving on to your second question. Which of the following is a common complication of trauma surgery? Guys, it's a baby question. It's more like a little general for you also. So I hope you're putting the right answer. Read properly, read your answers as well. You got time, you got more 9-10 seconds. And remember, proper wound care and early antibiotics are critical to prevent this condition. Nice. Very good. Very good. Moving on to the leaderboard. Everyone has scored points. We have Hemant leading the board with second position shared by Ray and Ashish, followed by Drake, Leo. So good going, guys. See the baby question. You get opportunity in each question. Okay. So let's moving on. TIC, that is trauma-induced coagulopathy, is caused due to. Now, guys, this is a little tricky, but still, you should know about this. It is usually from hypofusion. Then it's a cascade that complicates trauma care and demands quick intervention. And if you want a pro tip, early resistation with warm fluids and blood products can break this cycle. Nice. Okay. Okay. Guys, come on. How can hypothermia and hypothermia both cause? No? That's like thoda readable thing. Then Trali and Dorco do not cause TIC. That's for sure. All right. It's not hypothermia, it's hypothermia and alkalosis. For people who got confused between hypothermia and alkalosis, it is hypothermia and acidosis. Okay. So moving on to your leaderboard. All right. So we have a Soumya leading the leaderboard with the longest streak, followed by Thunderbreaker, Bhagya, and Urvashi. Your next question. Nexus criteria is for. See, it is used to rule out cervical spinal injuries in trauma patients. It's quick, efficient, and saves unnecessary imaging if the criteria are met. Think of it as a next VIP pass to safety. Let's see how many have got it right. Nice. Most of you have got this right. There's nothing known as LS, guys. It was a baby thingy. All right. So moving on to your leaderboard. Soumya is leading. Thunderbreaker, Urvashi. Congratulations to all of you. Moving on to your next question. Following a mass casualty, how would you triage the following patients? One has a degloving injury, another comes with a tension pneumothorax, third comes with a degree burns, and a person with a laceration on the forehead. Let's see, guys. Triage is very important. So I hope you know. Okay. So most of you have got this right. Remember, guys, this is your PYT. They have asked in the recent exam as well. So remember, PYT triage is one of the things that you score well if you remember them once. Or just keep revising it, okay? Just keep revising. Ooh, so the tables have turned. Soumya with the longest streak, Karthikeyan came to the second, and Thunderbreaker on the third. Moving. See, guys, each question will give you extra points. Just be fast and accurate. It's all the game about fastest fingers first with the focus. So it's a great going, guys. Moving on to your 7th question. Over here, you have to put what comes under what. So if you know what is a trilox triad, you can put the 3 things and what are the signs or symptoms that you can see in appendicitis. Okay. See, signs and symptoms are like are the breadcrumbs leading us to the diagnosis. Always connect the dots carefully for the right conclusion. All right. Guys, if you have any query or anything, you can always let us know in the YouTube section as well and just tell your socials also. So most of you have got this right and most of you have got this partially right as well. So it's a good going. All right. So moving on to your next question. A 45-year-old male patient comes to OPD. On examination, it is found that poor abdomen tenderness is present. He was chronically constipated, and in the blood report, it came as the TLC has increased. What do you think is the diagnosis? And if you can see the image as well, you can tell what it is. Remember, if you want an example, this is a picture of barium enema. So I think that can help you. And I would say this is the signs and the symptoms are the, the triad. So it's a tail triad. Okay. All right. Guys who have got Crohn's, remember there is string of Cantor that is seen instead of a sawtooth appearance. In this image, you can see it's a sawtooth appearance. Okay. All right. And for ulcerative colitis, you can see toxic megacolon. The colon is like huge, humongous. Okay. So moving on to your next. Oh, the leaderboard. What do we say? All right. So we have Karthikeyan leading the leaderboard with the longest streak, which is amazing. All 7 questions right. And then we have Thunderbreaker on the 2nd. Urvashi, Kaushal, Krishna, Soumya, Padu. What? Then there's Doctor who's playing the doctor's game. Then we have Vishnu Priya and followed by S. Many more, guys, many more. You all are doing great. Remember, each question is your chance. Be focused, be fast. Moving on to your next question. So I hope now, if you've been hearing proper, you would be able to answer this. I would give you some good time because this is one of your PYT and it has been asked plenty and plenty of times. You know how they call it tomato and some call it tomato. So this is that one. You have to remember it anyhow. So let's see. I hope. See, bloody diarrhea can be present. It's not a specific finding, but you have to rule out the infection first. All right. Nice. So most of you have got it partially or mostly right, which is great going. Very good. So the leaderboard says that Karthikeyan, then Thunderbreaker, then Urvashi, Kaushal. Nice. Great, guys. So this is going to be your last, I think, no. Second last question. Yeah. Second last question. Let's see how do you do. Now, over here, you have to match the tumors with their location along with the procedure and the ligate actions. See, guys, we know what is what. We know the signs and symptoms. So sometimes, what they want from us is a step ahead. So once you have the step ahead, this is a step ahead. And remember, if you want, you can always take a screenshot for this and keep it with you just for a revision. Because this is one of the excellent ways, everything is just written in your uh, slide and you just read about it. Let's see, time is ticking. All right. So most of you guys have got this right, which is very good. So it's a good going. Not much has changed. Oh, it has. Now we have Kartikeyan leading the board, followed by Urvashi in the second place, Thunderbreaker in the third, followed by Kushal, Krishna, Soumya, come on, Chronophenical, Ghost, Sanjay, and Padu. Good. All right. So last question in front of your screen right now. Over here, I've given you a definition so that you do not make a lot of mistake or any mistake. All right. So you should know where what does embolism mean and what does a thrombus mean. It is a basic difference and it can help you to get through this answer. And this question has been asked in your previous competitive exam. All right. So you should, for over here, embolism is a blockage or an obstruction of a blood vessel by an embolus, a particle or a mass. Okay. What is a embolus? It's a particle or a mass, and that has traveled from one another part of the body. All right. So at least now I know that you guys are able to know the difference between basics. And let's see who is the winner for tonight's quiz. Ooh. All right. It's congratulations, Dr. Kartikeyan. You have won tonight's quiz. It is commendable that you have been reading, and I hope you continue as well. Then followed by Urvashi. Congratulations, Dr. Urvashi. Thunderbreaker. Well, I think you have broken the thunder, I guess. Okay. So moving on to come to the YouTube section. All right, guys. So that's all for tonight, folks. Thank you for joining the JuxtaMed Quiz Show. Don't forget to follow us on socials at JuxtaMed Quiz Show for updates and exclusive content. Tomorrow, Dr. RMD and Dr. Manoj will stage even with more exciting questions. Until then, stay curious, stay tuned exactly at 10 p.m. and keep learning.